Welcome to another presentation by My Weight World. The title of this presentation is Liposuction Part 3. This presentation is designed to give you an overview on the topic of liposuction. Introduction. In prior presentations, we went over Part 1 and Part 2. In Part 3, we discuss expectations from the procedure, before, during, and after. Let's now examine what should occur before. Obtain a complete physical exam by a medical doctor, family practitioner or internist, to assess your overall health risk. This is especially important for older adults and those with known medical problems. Some liposuction doctors will have this as a requirement prior to undergoing surgery. For example, if you are found to have severe diabetes or heart disease, your risk for surgery goes up, and you may elect not to take the extra risk, or your liposuction surgeon may elect not to do your procedure. Before you obtain the surgery, you should ask your liposuction surgeon all the questions you have. Caution for any surgeon who will not spend time to make sure you thoroughly understand the procedure and go through your concerns and questions. Consider doing research prior to seeing the surgeon. Bringing a written list of questions will make sure that you don't forget key items. Many people get nervous in front of doctors and forget what they want to ask. Unless your surgeon says you can drive home, you can pretty much expect that you will need someone to take you home after the procedure. The surgeon may give you pain medication or anesthesia, which would make you drowsy and less reactive at the wheel. Therefore, you should arrange one of the following to take you home: family member, friend, limo service, or taxi. Ask your surgeon before surgery how much time you will need to take off of work or school following the procedure. Ask other related questions such as medications you will need to take, and get the prescriptions filled, if you will need dressing supplies, if you need to take or not take any medication prior to surgery, if you can eat or drink just before surgery, and what time to show up. The more prepared you are, the better the procedure will go. Now let's examine the day of surgery. There are a couple of different anesthesia options, used individually or in combination. General anesthesia. Some procedures are more painful than others, and the surgeon may elect to have you go completely asleep. This is called general anesthesia. Sedation. Less intense procedures can be done with just sedation without putting you under a general anesthesia. This can be done through sedative pills or intravenous medications. Local. Anesthesia medicine, fluids, and usually epinephrine are used to do the actual procedure. A local is performed in order to reduce bleeding, epinephrine, reduce discomfort or pain, and help suck out the fat. Marking. A surgeon will typically mark your body with a pen to indicate where fat is to be removed. This is typically done just prior to or after you are asleep or sedated. Procedure. After anesthesia is working, small cuts are made. A cannula, a hollow tube, about the thickness of a pen is inserted. This is connected to a suction machine. The cannula is moved back and forth. The movement along with the injected fluid liquefies the fat which is sucked out. Intravenous fluids. Liposuction removes not only fat but also liquids. For larger procedures, your surgeon may elect to give you some intravenous fluids, salt water for example, to replace large losses. After surgery. Overnight. Some larger or longer procedures will require you to spend the night in the hospital or surgical center. Returning to work or school. Ask your doctor when you can go back. Drainage tube. Some doctors place temporary drainage tubes that come out in a few days or a week or so. Medications. Pain pills and or antibiotics are common. Try and get these filled prior to the surgery. Dressings. Typically, you will be asked to wear tight-fitting dressing for a few days to a week or so. You may also be asked to wear tight-fitting garments. This is to keep your skin compressed and minimize fluid collecting under the skin in the area of surgery. This can be provided by the doctor or purchased at the store. As far as activity goes, some limitation is typical for a few weeks. Leakage. Many people will experience leakage from the cuts for a brief period of time, typically a few days. Ask your doctor how to tell if this is okay or a complication such as infection. Infection. Rare. Again, ask your doctor what signs of an infection look like. If there is any question, call your doctor. Black and blue. You may be bruised in the area of liposuction for a few weeks to months. Scars. Your small cuts will form scars, usually remaining small. How does it look? Liposuction rarely produces a perfect result. Ideally, it should be cosmetically pleasing. Make sure you understand what your outcome is predicted to look like from your doctor. Don't have unrealistic expectations. Summary. Obtain a complete physical exam. Ask your surgeon all the questions you want prior to surgery. Do your homework and research your procedure. Have someone drive you home. Have realistic expectations of what your outcome should look like. This has been another presentation by My Weight World.